So this is a slide I made in 2006, and it's the guy there is Donald Rumsfeld, and some of you will remember his famous unknown unknowns and known unknowns. And at that time, I was Chief Executive of Cancer Research UK, and we'd managed to very substantially increase the organisation's income. So I had money. And the guy who ran the British cancer health system, a guy many of you will know, Mike Richards, who was our cancer czar, was very simpatico. So Mike and I were a pair of robber barons, and we could do things. And Mike realised that he had no data. He knew nothing about what was going on out there in the health service for which he was responsible. But Britain was in a unique position because we had complete primary care data. We had complete hospital record data. We'd had complete cancer registration by law of every patient since the 1960s, and we had the death records. And I gave Mike never more than €500,000 a year to have a team to start analysing this data. And I remember to this day the first outcome that I saw, which was that 5% of our primary care doctors in Britain hadn't diagnosed a case of cancer for 5 years. Every one of them should see about 12 a year. That's thousands and thousands of patients who were first diagnosed in the hospital emergency room, with all the consequences of that, of their chances of survival. So from 2008, when this data started to come together, until 2012, the analysis that was conducted was a complete game changer in every respect. But there was a problem, and I finished my stint at Cancer Research UK. The enthusiasm of Cancer Research UK for this was muted because, as you'll see, it doesn't have the CRUK logo on that slide. So my successors said, well, this is somebody else's problem. And at that time, we had a change of government which changed the ministers in charge of our Department of Health. And we had a particularly bad one for all of these data sources, which of course came out of the NHS, to be retained in the NHS. And one or two megalomaniacs realised that they could build a career by having sole access to this material. So from 2013, I promise you, data in the UK ceased to be available completely. And people like me were saying, this is an outrage. Nothing happened. The first thing that changed was COVID. So 7 years later, they said, you can have the primary care data, but only for research into COVID. And out of that availability came the use of steroids in the management of COVID in the acute phase, and most of the world's studies on vaccine effectiveness. End of 2022, they turned the tap off. And I said, hold on a minute, COVID killed 100,000 people in Britain. Cancer kills 3 times that every year, and will carry on doing so forever. We still haven't got that data. And as of 2 days ago, at the board of, Leroy mentioned UK Biobank, which is a fantastic epidemiological cohort study, with 500,000 patients who've all consented to have their data used for research purposes. We still can't get that data out of our National Health Service. And I've only shown this to remind us all that we all know how important data is going to be in making a success of all the things we'd like to do, but don't ever regard it as a given. because the wheels can come off the wagon spectacularly. And the British have disgraced themselves in this space. It really is utterly unforgivable. But if they can screw something that was so good up so comprehensively, then jurisdictions that are much further down the learning curve on this need to remember how quickly the politicians decide that what's emerging from the analysis makes it look as though they're doing a poor job of running the National Health Service. That's what's at the back of this. It's politics and stupid people. Thank you, everybody, for that session.